and he was able to publish some original articles, including description of many new blocks techniques. Dr. Ahmed has an enthusiasm about education that led him to create a YouTube channel that is watched by thousands of viewers. Additionally, he is regular participant as a faculty in major workshops in the region of the Middle East. Thank you, and the time is yours, Dr. Ahmed.
Thank you, Dr. Talhat, so much, and inshallah, I hope this today will be a very good lecture, inshallah. Bismillah ar-Rahman ar-Rahim. Today, inshallah, we'll talk about the blocks in a workshop for abdominal blocks. As you know, that blocks is very important for pain control because it's the quality of pain control as well as minimizing the side effect of narcotic. However, in the abdomen, we have additional factors that make the blocks are necessary and sometimes. First is that we know that the abdominal incisions may affect the respiratory mechanic. A high percentage of abdominal surgery resulted in chronic pain. And many of procedures in the abdomen result in DVT. So early ambulation is important, and so pain control is very important to achieve such thing. We have in limb blocks that we have the nerve is big, and we can see it. And as you can see, we can inject local anesthetic around the nerve, what is known as perineural injection. However, and the trunk innervation are very small, and usually we cannot visualize it by ultrasound. And so instead of perineural injection, we do one injection type of injection called interfascial injection. In this interfascial injection, we are determining the fascial plane where the nerve running and place the local anesthetic there, where the local anesthetic spread to this nerve. So the key of success of this technique is that first is accurate fascial planes identification, and inshallah in this workshop will show many of these fascial planes. And second is the volume of local anesthetic. The higher is the volume, the high success. Fortunately, this block work with very low concentration of local anesthetic. Even 0.15 norepinephrine or ropivacaine is very effective. And sometimes I add DEXA to prolong this duration of analgesia. The block distribution of this local anesthetic is not constant in every patient, and so most of these blocks are used as analgesia. However, in some selective cases, it can be used as anesthesia. I'll show one or two slides regarding this. The abdominal innervation is divided in two categories: the visceral innervation, which is innervated by the sympathetic or autonomic, and the abdomen is entirely sympathetic, and the pelvis is sympathetic and parasympathetic. The good point here that is almost all organs of the upper abdomen is supplied by celiac plexus. And so if you block, and celiac plexus supplied by 5 to 9, T to 5 to 9. So if you block these segments, you block the spleen, the pancreas, the liver, the stomach, and gallbladder, and even the first part of the duodenum. So